Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. All over the world, as at April the 25th, there were over 2.8 million confirmed cases of COVID-19. There have been over 197,000 deaths and more than 789,000 recoveries. At over 900,000, the United States of America had almost a third of the world figure and more than quadruple the confirmed cases in Spain, which is the second hardest hit nation. In Nigeria, in the same time frame, across 27 states and the FCT, there were 1,095 confirmed cases, 208 recoveries, and 32 deaths, with Zamfara recording its very first case. Lagos has the highest number of cases in Nigeria, 657, which is 60% of the country's total burden. My guest is a member of the Association of Medical Officers of Health in Nigeria and a public health physician, Dr. Adebayo Akintayo. You're welcome to the show.
It's a pleasure.
We are alarmed at the number of health workers who have tested positive to COVID-19. Why is this happening?
Well, we're now in a war situation. The war situation between the human beings, of which the medical practitioners are subsets, and the pathogens. And in a war situation, the best to do determines the quality of the weapons you have.
So are they not suiting up well enough?
Going into the local philosophy, most of the time, the warriors tend to feel that, oh, I've learned the tricks of the battle. And in the process of laying back, there may be a chip in the armor. And that chink in the armor is what causes the problem. Most of the times, medical professionals, we have a reservoir of knowledge on how to prevent infections, on how to treat infections, and so on and so forth. But at times, when procedures and processes are not followed, particularly as it relates to infection prevention and control, the weakest link is created, and that is where the bullet comes in.
So we have to actually encourage them to just keep up. It's been a long war, but we need them, you know? We need these health workers, so they shouldn't get careless.
Apart from, don't let me say carelessness only. Most of the times in a war situation, the first thing that comes to mind is how to save the precious or the valuable things. And in most of the time, the medical professionals, having understood the basis of infections and the complications that can arise when immediate attention is not provided, medical attention is not provided, they tend to manage the little resources that they have. And in the process, most of the times things usually go wrong. And that is why, at the moment, the health professionals need to really come up and speak out on the basic things that they actually need, particularly the infrastructure that would enable us to fight this pandemic appropriately.
So is there any particular infrastructure that you need?
Well, when we talk of infrastructure, in my own estimation, part of it is the knowledge infrastructure.
Okay.
the knowledge infrastructure, yes, the health workers have the knowledge infrastructure. Of course, we know that the frontiers of knowledge keep on expanding every day. And the knowledge we have yesterday might not be relevant today. So we need to continually ensure that we're expanding our frontiers of knowledge as it relates to infection prevention and control. We also need to ensure that the other infrastructures, the physical infrastructure needs to be there. When we talk of the physical infrastructure, the hospital environment, there is a specific way, the engineering or the ergonomics, how things are supposed to be arranged in order to curtail this spread of infection.
I assume you're talking about more space?
Yes, space and the organization, the flow of work. So those are things that are there. Then apart from that, part of the physical infrastructure are the consumables.
Yes, masks, gloves,
the mask, or the
PPE.
PPEs.
Are those available?
PPEs. Well, the point is that, of course, they are available, but in limited quantity. Most of the times we take so many things for granted. Because of the fact that at times our strategic plans regarding infection prevention and control is not adequate. It is when we need gloves that we think that our glove is not available.
Instead of applying ahead of time.
Yes, there is,
so that
instead
it doesn't
of doing
finish.
the appropriate stock level management. So those are the issues.
Now, it appears from what we hear and what some people say they've seen that the response to COVID-19 is affecting the care of people with other problems. For example, people say, I don't want to go to the hospital for a simple malaria. What if they give me COVID-19 when I get there? I might as well just buy my medication and take it peacefully in my house. But then that person might have COVID-19. So how do we handle this situation?
Well, I think that brings me back again to the knowledge infrastructure.
Before you go on, there are others who have said some people actually have been rejected from hospitals because they were coughing. Maybe there was a persistent cough and they're like, no, do not come here. So there's a lot of
that brings me back to the knowledge infrastructure that I'm talking about. In this part of the world, some people believe that what we should concentrate on is the stomach infrastructure. Of course, that is important because an hungry person may not even be able to assimilate. But then knowledge infrastructure is important because it is what one doesn't know that kills. Ignorance kills. On part of the public, the basic infection prevention and control, the knowledge of it, they don't know. We're just glossing in the groping in the dark. And people would rather listen to non-professionals. They would rather listen to religious speculations instead of listening to evidence-based scientific speculations on the spread of infections. And those are the things that worsen the situation. Now back again to the fact that some people, instead of, let me put it this way, at this moment and at any other moment, it is dangerous to do self-medication.
Okay. Because
medication or drugs generally, or medicines generally, they have specific effects that they are supposed to do. Then they also have the side effects, the known side effects and the unknown side effects. If drug abuse is encouraged, people may end up killing themselves
So in other
by poisoning
words,
themselves with
they should
certain
come
drugs,
to the hospital.
they should come to the hospital.
Now, some people have actually come to the hospital. Maybe somebody feels they have malaria or just a common cold or cough or something, and go to their private hospital that they're used to going to, and the person ends up having COVID-19, or rather the person happens to have COVID-19, not that they got it from the hospital, but that they came with it. How does a private hospital handle that? Can a private hospital receive a COVID-19 patient without knowing and still get no other person infected besides that particular person? Can they do that? The person comes in with COVID-19 and leaves without infecting another person?
Well, it's going to be very difficult for that to happen. Because there are so many processes and protocols that has been established to reduce transmission of infection. The very moment those protocols are broken, there is no way one can guarantee non-transmission of infection.
Can you take us through this protocol?
Well, part of it has been in existence for a very long time. It's what we are doing now. Social distancing, physical distancing. Because as I'm speaking now, vapor droplets are coming out from my mouth, but they don't have the speed to reach you where you are now, or the power to reach you where you are now.
Okay.
But if we are closer, it is possible for that to happen.
So is this supposed to be standard procedure in the hospital with or without an outbreak?
It's supposed to be the standard. Part of it is that in every hospital, there is supposed to be a station where they do what we call triage. Triage is just a French word that only means sorting out.
Sorting out, yes.
How do we sort out patients? We sort out patients by way of the complaints or symptoms.
Okay.
A trained professional would know the basic the basic inflammatory factors.
Okay.
There are about 5 or 6 cardinals of inflammation. Inflammation simply means the way the body reacts to something strange. Of course, an infective agent is a strange being in the system.
So it would cause
the
an
body
inflammation.
system, first of all, responds to it in about 5 various ways. The first level is fever.
Go ahead.
So, and that's why part of the symptoms that we commonly check in the hospital is temperature.
Okay.
If there is a rise in temperature, that will give an impression that there is fever. And if the fever is there, there could be an indication that an infective process is ongoing in the system. Some other may come with some other symptoms. So we can do syndromic sorting of patients.
Let me hold you there. We will come back to that. But let's go on a short break now. We're taking a really short break. Please join us after it. Welcome back on Health Matters. We're discussing COVID-19. For questions, you can call 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A. We were talking about triage. Now, temperature. This is what normally happens when you get to a hospital. You sit down till you're cold, then you go and meet a nurse. You sit in a chair. She takes your temperature, your weight, and your blood pressure, right? Now, assuming somebody comes in with a high temperature, maybe this person is suspected of COVID-19. The person has already sat on the general chairs. Then the person has sat on the particular chair for the nurse's station. What is supposed to happen after they discover this temperature is too high? But before you answer that, let's take a call from Abuja. Hello.
Hello, good afternoon.
Good afternoon.
Yes, my question is to your desk and also to Channel Television.
Right.
I want to know what you guys are doing in the area of advocacy on a nationwide policy for the use of face masks.
Okay.
This is the rocket science. The coronavirus can only be transmitted through respiratory droplets, which comes from the mouth and the nose.
Okay, thank you very much. I'm losing you, Peter, but I've got the substance of your question. What are we doing for advocacy to use face masks?
Well, as it is now, social distancing has become problematic because a lot of people are not observing it. Like I said, because of inadequacy in the knowledge of why it's supposed to be done. So the only other way by which we can protect ourselves is to encourage wearing face masks.
Okay. And Lagos State is doing something about that, isn't it?
Yes.
In fact, the federal government.
Yes. Because the face mask will shield whatever vapor or fluid that is coming from an individual from spreading or touching another person.
Okay.
But it must not be done in isolation.
Aha.
We must establish a culture of hand washing. We must establish and sustain the culture of hand washing. I recall when we had Ebola, everybody became an advocate of hand washing.
Yes.
But shortly after the Ebola crisis became history,
and we're back to our normal selves.
We must develop and maintain, and if possible, ensure that the necessary structures are available to ensure that people maintain hand washing as a culture.
Okay, let's go back to the triage we were talking about. The seats, general seats have been sat on by this person, and the person has sat at the nurse's station. You're suspecting COVID-19. What do? Do you have to wipe all the seats down or what?
Well, like I said, there are basic infection prevention and control protocols and procedures. Ideally, all surfaces, whether in the hospital or in public places or even in the home, anywhere you can think of, supposed to be decontaminated periodically. Because we are all living, dancing and whining in the sea of infections.
They make it
Most
sound
of those
horrible.
microbes we cannot see them by our eyes. And that's the reason why people must be encouraged to understand the fact that the only way by which we can prevent infection now is to develop that culture of hand washing, social distancing, and again ensure that our environment is decontaminated.
Let's take this call from Steve. Hello, Steve.
Good day, ma'am.
Good day. What's your question?
Yes. My question is this. Ordinarily, one used to have cough. Ordinarily, one used to have catarrh. Why is it now every catarrh or every cough is directed to COVID.
Okay, thank you very much, Steve. I don't know whether that's a fact, but he's asking why is every cough and every catarrh COVID suspect when normally a cough or a catarrh is a normal thing anyway?
Well, even when we look at our environment, there are a lot of contaminants in our environment. Contaminants from even the exhaust from vehicles, from generators, and so many other things. All those things irritate because, of course, they are suspended in the air that we breathe in.
Yes.
So we are
For
no
some,
longer
it's
breathing
pepper.
in. Yeah, so we're not breathing, no longer breathing in clean air as it is. So that's why, even as I'm looking at it now, I think lockdown has really reduced the vehicular movement, and in the process, is a maybe by default we are cleaning our environment, the air for ourselves. So coughing and sneezing ideally is supposed to be a normal reflex. Supposed to be a normal reflex. But in the process of coughing, there are some microbes that are lodged in the airways. Because of the force of the air that is coming, they might be ejected out.
Okay.
And the process of ejecting them out, you eject them into the space. And whoever that is nearer.
So we might as well keep our social distancing with or without COVID.
If he falls on the cloth or falls on the chair and the person does not immediately wash the hand, so you keep on spreading it.
Let's take Michael from Benin on the line. Hello, Michael.
Yeah. Good afternoon.
Good afternoon.
According to the last caller.
Okay.
The man there, I did not answer that question.
About why every cough is suspect?
Yes, every cough, not just that now. Let's say the patient that was now discovered in the hospital that is COVID-19. Now he left his home. He met with people. The vehicle that conveyed him or her from his or her house that brought him or her to hospital. The people he met with before he got to the nursing room or whatever, wherever. So you ask the question that how would he such people with?
Okay. Thank you, Michael. I've got the substance of your question. He has added to the question, and beautifully too. The person who is coming to your hospital who happens to have COVID-19 probably came in a bus and he has touched other people. He has mingled. He sat on the seat, the general reception seat, and also the nurses' station. But let me even put this by you. Some people have suggested that why not do the triage outside the main hospital, maybe in a tent or something, somewhere that can be easily cleaned and fixed up, and then separate your patients from the tent. This is just a suggestion I heard from some people, and have a separate room for somebody who is suspected so that he does not mingle with other patients. And that would be in every hospital, private, public, everywhere.
That's why I say that what has happened now what I mean that post-COVID, we'll be able to
You have 1 minute, sir.
We'll be able to address some of those things. Ideally, that's what it's supposed to be.
Okay.
The perfect triaging is that before they enter into the hospital, in fact, even now we're supposed to be using technology. You don't necessarily have to come to the hospital. You can do medicine. Call in helpline to your doctor, and if the doctor say, okay, ask some questions, if he feels that you should come to the facility, then of course they're already prepared for you.
That's right.
So some of those things, if we employ the technology as well, it could assist us in reducing the transmission of infection to a very great deal. But one thing that must be done is that in this country, doctors are not really giving the prescription rights. A lot of people who call a doctor, get professional advice, without appropriate remuneration.
Okay. What I want to add to that is you've already helped by saying that people who feel they are sick and have a temperature or any of those symptoms should actually call from home.
Yes.
So most of them shouldn't be entering buses. That's to answer Michael.
Exactly.
But I have to stop here because we're out of time. But thank you very much. I hope some of these things can come into practice in every hospital so that we can avoid infections. Thank you so much, Peter, Steve, Michael, for your calls. It's time to go. I had a wonderful time with you. Let's do it again next week. Bye-bye.